Hi, this is Dr. Don Bonner with Personalized Wellness, and today we're going to do a video on hormone optimization in men, the do's and the don'ts. I'm doing something a little bit different this time. I'm going to do a PowerPoint presentation. Unfortunately, I'm not going to have my face out there on a video recording, so sorry about that. The idea came about doing this presentation because I've noticed a lot of clinics popping up around the area for testosterone replacement in men. And I thought it'd be a good idea to put out my thoughts on how hormones should be prescribed to men, and again, the do's and the don'ts, so to speak. This slide, I like this slide because this is Eugene Sandow, and some of you may recognize that he's the person that's on the Mr. Olympia trophy, which is the bodybuilding trophy. And the thing I like about this video is that this is a turn of the century individual that was very muscular, and he was very natural. So I think it's very obvious, or at least it's, you can build muscle, and all you need are your own hormones to do that to a great degree. And I'm a big advocate in muscle, and I really believe that the more muscle that you can maintain as you age, the better you age and the more graceful you age. And I feel that way about women also. So I think it's super important that we keep this in mind and really look to maintain our muscle mass for as much as possible. Now, the other aspect of this, and I'll go into that and into some other slides to a small amount, but testosterone has huge benefits for men other than just muscle development. It helps prevent dementia. It prevents cardiovascular disease and stroke. It increases bone density. It has all the sexual benefits that we think of with testosterone as far as libido and erection quality and that sort of thing. So testosterone is very important to men at all phases in life, and I think that it's definitely a big advantage as we age. Okay, this is me, Dr. Don Bonner. I'm a board-certified anesthesiologist. I'm board-certified in metabolic and nutritional medicine, and I have a fellowship in metabolic and nutritional medicine from the American Academy of Anti-Aging Medicine. So that's where I learned a lot of this information. I would say that I also have learned a great deal from Dr. Rougier, who I think is very clearly one of the top hormone optimization physicians in the country. And he's really put together a lot of research to basically, put the science behind prescribing hormones. Okay, this is our clinic. Just really quick, Personalized Wellness. We're located at 1220 Highway 51 in Madison, Mississippi. Phone 601-898-0911. That's our website there at the bottom. Give us a call. We'd be happy to see you at any time. And we do more, obviously, than hormone replacement. We'll talk a small amount about that in just a moment. So what brings people into the clinic? I mean, the first thing that you need to look at are the symptoms of low testosterone. Symptoms are incredibly important, and we really look at these on all of our patients, but we're talking about male patients today, and we want to get rid of as many of these problems as we can as we replace testosterone. So it's not so much a numbers game as it is increasing testosterone levels to try to, improve the quality of life and getting rid of some of these symptoms. and you can read these, very, very common symptoms that we see with testosterone being low. Now, when you go to see somebody, you need to have a workup. This shouldn't be a 5-minute visit that you go see somebody and there's a cookie cutter protocol. You need to see a provider. They need to do a history and physical. They need to know something about you and your medical history, what medications you're taking, what allergies you have, just a usual workup. Now, some of these workups are longer than others. I have some patients come in that obviously are much more, have progressed much farther down the line of not being in good health, essentially. They may have metabolic syndrome, they may be very overweight, they may have hypertension, diabetes, all of these things that we look at. So obviously those workups are going to be a little bit longer. But I definitely stress on the workups that it's not just hormones. You see hormones are in there that, are things that we look at, and not just the sex hormones. We're looking at cortisol, thyroid, vitamin D levels, all of those things also. But I really stress lifestyle medicine to a great degree also. And diet, nutrition, sleep, and stress management are very, very important to age well and to have vitality as we age. So those should definitely be stressed. Lab work, this is kind of the basic lab work that we run on all of our male patients. You want to get a CBC, you want a complete metabolic panel, you want to know a PSA, vitamin D level, sex hormone binding globulin, total testosterone, all of your thyroid profile, and you want a free testosterone. This could be a lecture in itself as far as lab work, but this is what you should be seeing when you go to a clinic and what you should be getting when they work you up at that particular clinic. So here we go again, history and physical, lab work, the symptoms. The other thing that you want to bring up and to make very clear with your provider is the idea of fertility. I mean, are you a 28-year-old man who has low testosterone, but you're married or in a committed relationship and you want to have children? That's a whole different story than a 55-year-old man who has had his children, they're grown, his testosterone is low. So you need to have those conversations because there's different ways of dealing with low testosterone if fertility is in question. There's drugs like Clomid, there's HCG that you can use to raise testosterone levels. You can give testosterone and HCG to try to maintain fertility. There's a lot of different ways of doing this, but that definitely needs to be part of the conversation. Now, there's several routes of administration as far as testosterone goes. In men, I've listed oral. I would never recommend taking oral testosterone for men. I don't think it's a healthy way to take testosterone. You have a first pass effect through the liver with testosterone and metabolites, and increases your risk of blood clots. There's a lot of things that I don't particularly like about the oral form. Gels are one of the first things that were, androgel's been out there a long time. I don't particularly like gels. They tend to be messy. You have to use a lot of the gel to get a good dose, and they're sticky. You're at risk for transmitting to other people. I don't care for them that much. Skipping down a little bit, pellets I've listed at number 4. Pellets are a route of administration. You can do it. I still do pellets on a few men. It's not my favorite route of administration. You do have to do a minor surgical procedure to implant the pellets. There's a little more pain involved, obviously, because of the implantation. You can extrude pellets. The other thing that I'm not crazy about, it's hard to adjust the dose with the pellets. If I put pellets in and then you come back with a low blood level, you're not feeling well, it's hard to adjust that dose. Creams and injections are my primary routes of administration. I use a lot of testosterone cream. That's probably 90% of what I do. You can use it daily. You get good blood levels, and I really like the testosterone creams. Injections work really well also, and we're going to talk about injections in the next slide when we talk about frequency. The problem with injections that you run into is the frequency of the injections and how they're given. Obviously, the very best way that you could do injections would be to do it daily, but I haven't met any guys yet that want to do that. You can do it 2 times a week. You can do it 3 times a week. A lot of clinics do it once a week. I've even seen some clinics that do it an injection every 2 weeks, which I don't think is adequate at all. The problem is as you stretch that time out, you have to give a bigger dose, and you tend to roller coaster a lot more with your levels going up and going down. So with injections, the key is to do it as often as possible. Another thing I wanted to talk about real quick when we're talking about frequency, there's a couple different ways to inject. You can do IM injections or intramuscular injections, or you can actually do sub-Q, which has been shown to be fine. And I tend to use more sub-Q injections. Okay, estrogen. This is a big controversy. For years, many of us blocked estrogen with aromatase inhibitors because testosterone is converted to a degree into estrogen. And I do not use aromatase inhibitors at all anymore. The reason being the science doesn't back it up. And if you look, Dr. Ruzzi has done a tremendous amount of work in this regard, and he strongly advocates not blocking estrogen because estrogen provides a tremendous amount of benefits to men, believe it or not. You know, we talk about side effects of estrogen, and I was guilty of this for years also. I believed the gynecomastia story, you know, fat distribution, you're going to look more like a woman as estrogen levels rise, sexual, side effects, the estrogen was going to cause poor libido, erections, all of those things. And what the science has shown, Dr. Ruzzi has tons of studies on this to show that estrogen is incredibly beneficial in men, and upwards to 50% of the entire benefits of getting testosterone in a man comes from the estrogen that's made from the testosterone. It helps increase bone density, decreases cardiovascular disease risk, there's lipid improvements, and there's actually an improvement in erectile function and libido. So I strongly advocate not using estrogen blockers. I've seen many guys that have been to clinics that use estrogen blockers, and they drive their estrogen levels down way too low. And when you do this, you're at real risk for cardiovascular disease, and you're at real risk for osteoporosis because of the low estrogen levels. So I really advocate not doing it. Another thing, HCG, we talked about HCG earlier to elevate testosterone levels in men that want to remain fertile. Unless you're one of those people that want to remain fertile, I don't believe in using HCG. I don't use it. I don't like it particularly. I say I don't use it. I've probably got 3 or 4 guys that use it, and the reason that they want to use it is for testicular volume. When you take testosterone, your testicles will shrink by 20 to 30%. And I have some guys that this is a big issue for them, and the HCG helps maintain that. But again, I don't think you need to routinely use HCG. Okay, erythrocytosis. This is the other issue that you come up with. It's a big controversy with testosterone replacement. You are going to elevate hemoglobin hematocrit with testosterone. Now, is that dangerous? the medical community believes that it is dangerous, and that when hemoglobins and say hematocrit get above 53 or so, they strongly recommend giving blood, dumping blood. I do that myself at this time, but do I think it's dangerous? I really don't think it is. It's an erythrocytosis. It's not polycythemia vera, which is a cancer. And that's where we've kind of extrapolated this data. Polycythemia vera, all the cell lines are elevated, especially platelets. Elevated platelets cause you to clot, and it is a real problem. But with testosterone replacement, you don't get elevated platelet count. But medical legally, this is a gray area. I think, I still treat. If I have a guy that's elevated, I will tell him to give a unit of blood. Okay, after you get your testosterone, we've started you on a program. You should be seen back in clinic in 4 to 6 weeks, somewhere along those lines. Get your levels drawn again. See where you're at. What are your symptoms? Have your symptoms completely gone away? This is the art of giving testosterone therapy. You want to be looking at the symptoms, and you want to be looking at the patient, not just the numbers. I have guys that have start off with the testosterone level of 250. We get them up to 700, 600, and they feel great. All their symptoms are resolved, and there's nothing else we need to do. We don't have to push that level on that patient, and they do perfectly fine. I have other patients that we may have to get up to 1,000, 1,100 or higher to get full symptom resolution or most of their symptoms resolved. So there's an art to doing this, and it's not just about following the numbers. And the other thing is, this is not a cookie cutter sort of thing where you come in, they give you pretty much the standard dose that they give everybody. You get HCG, you get an aromatase inhibitor from day one. I just really don't believe in that philosophy. So those are things to just watch out for. So this is what I'm talking about here with these protocols. I don't think the protocols, you shouldn't be at some place where the protocol is standard. It should be individualized and tailored to that individual by symptoms, lab work, by their medical history. There's a lot of things that go into this, and you want to make sure the person that's prescribing knows what they're doing. Very, very important. So questions. Any questions you might have, you can email me at, as you see here, this is my email, drbonner@thewelldoc.com. I have a YouTube channel, Dr. Don Bonner. You can go there to check out any of the videos that we have. This video will be uploaded to YouTube. And again, you have to do your own due diligence. You have to look around. You have to find a place that knows what they're doing. The cost should not be exorbitant, but you're going to have to pay a certain amount to get somebody that knows what they're doing and is going to monitor you and provide this medication the way it should, be provided. So again, do your due diligence, look around, and if you want to come and see us here at the clinic, again, our phone number is 601-898-0911. Otherwise, have a good day, and thank you for watching.